Our research project was a systematic review which was titled Probiotics as an Adjunct in Non-Surgical Periodontal Therapy. The purpose of this review was to evaluate whether or not the adjunctive use of probiotics in non-surgical periodontal therapy was effective in treating periodontitis. Therefore, the formulated focus question under the PICO schema was, in adolescent to elderly human patients with periodontitis undertaking non-surgical periodontal therapy, will the use of probiotics in any form compared to the use of placebo show effective clinical outcomes? To address this question, a systematic search for randomized controlled trials, cohort studies, and case control studies published in the last 10 years pertaining to the focus question was conducted. Databases such as Scopus, Google Scholar, Medline, PubMed, Web of Science, CINAHL Complete, and Cochrane Library were utilized for the search.
The titles and abstracts retrieved from each database were screened by 2 blinded reviewers to assess whether they fit the review's eligibility criteria. The full text of the selected studies was then reviewed by 2 reviewers, separate from the previous reviewers, for eligibility, and they were also blinded to each other's decisions. Any inclusion conflicts were resolved by a 3rd reviewer. Quality and risk of bias were assessed with 3 reviewers in a similar manner to the full text selection through the Cochrane Collaborations tool. A total of 593 studies were retrieved after duplicates were removed, but only 12 were included after sequential analysis.
4 probiotic delivery methods and 7 main probiotic groups were evaluated from the 12 articles selected. The study on Lactobacillus delbrueckii and Lactobacillus fermentum used delivery through probiotic sachets concluded that it was no more effective than standard scaling and debridement alone. The study on Saccharomyces boulardii in combination with prebiotic fructooligosaccharides described it to be an effective adjunct as a powdered mixture, since a significant reduction in probing pocket depth and clinical attachment loss had occurred in the treatment group. Lactobacillus reuteri used mainly in lozenge form, but was also reported in a sachet form. Lactobacillus reuteri in lozenge form did not contribute to significant improvements in 3 studies, but did in 1, and displayed an intergroup improvement in the 1 sachet study. Bifidobacterium animalis was also assessed in a lozenge form and was reported to be an effective supplement in scaling and debridement of chronic periodontitis patients. Studies by Morales concluded that Lactobacillus rhamnosus delivered through sachets did not deliver any significant improvement as an adjunct to treatment. Finally, 2 studies used a combination of probiotics in lozenge and tablet forms. The lozenge study produced clinical attachment loss improvement in the test group, while the tablet study was ineffective.
To summarize the success of adjuncts by delivery method, sachets were only effective in 1 of 4 studies. An adjunctive tablet was ineffective. A powdered mixture led to an improvement, and lozenge deliveries described improvement in 3 of 6 lozenge studies. The 2 main difficulties with this review were the short follow-up periods in each study and the heterogeneous nature of the studies retrieved. The short follow-up made it difficult to ascertain whether improvements were permanent or transient, while heterogeneous studies made comparisons challenging. For example, differing scale and debridement approaches, as well as variable follow-up periods. This heterogeneity is especially significant as pretreatment affects colonization of probiotics.
So in summary, with the studies included in the systematic review, it is currently difficult to draw a conclusion on whether probiotics is an effective adjunct to non-surgical periodontal therapy in treating periodontal disease. The probiotic strain, mode of application, and study designs are too diverse for adequate comparison of results. In the future, it is suggested that clinical trials attempt to conduct a homogeneous methodology and that it includes the measure of gingival trabecular fluid for inflammatory markers in order to precisely evaluate the effectiveness of probiotics. And we're done.